My name is Omar Rahal, and I'm an internal medicine resident at Beaumont Dearborn. I'll present this case entitled A Novel Cobiotic Associated with Improvement in Symptoms of Psoriasis and Psoriatic Arthritis. To start with, it is very important to understand that our gut microbiome plays an important role in the regulation of the immune system. When this microbiome gets disrupted, which we call gastrointestinal dysbiosis, we believe that dysbiosis is associated with immunological inflammatory conditions, such as psoriasis. This pathophysiology relies on the idea that normally we have tolerogenic gut bacteria producers of fatty acids such as butyrate, which modulates oxidative stress by production of glutathione and also maintains helper T cells and regulatory T cell balance. One of those bacteria called Faecalibacterium prausnitzii. The theory behind our case study is that if we correct the gut dysbiosis, this will create an environment that promotes growth of immune tolerogenic strains of bacteria and reduce the pro-inflammatory strains, and thus this will reduce the symptoms of inflammation and improve the symptoms of psoriasis. We present actually a case of a 56-year-old male who tried a cobiotic to fight his psoriasis and arthritis symptoms. This cobiotic was initially designed for pre-diabetic individuals and is actually taken twice daily as a smoothie. The cobiotic contains an inulin, which is a water-soluble fiber, and a beta-glucan, which is an oat extract. Those will expand fatty acids, producing butyrate that we talked about, which increase tolerogenic microbial populations and hopefully improve oxidative stress and improve immunity homeostasis. The cobiotic also contains a sugar-free blueberry extract that may improve psoriasis rash through the effect of delphinidin through pro-differentiation properties in keratinocytes. So back to our patient. He has a 13-year history of severe plaque psoriasis and psoriatic arthritis with significant impact on quality of life. He's currently being managed through diet and topical cream. He used to be treated with methotrexate but stopped pharmacotherapy 5 years ago, 5 years prior to the visit due to side effects intolerance, and does not want to resume pharmacotherapy. In the interim, patient noticed that certain food worsened his symptoms, such as meat, dairy, gluten, so he decided to try the cobiotic on his own. The patient was evaluated on a monthly basis for 3 months, and improvements in psoriasis, rash, and arthritis were noted. So as you see in Table 1, there was a significant reduction in joint tenderness and swelling from 24 and 16 to 2 and 2 respectively, around 3 to 4 months. This actually met the criteria for improvement according to the Global Psoriatic Arthritis Response criteria. The patient also noted that the area of his psoriasis rash decreased, especially on his arms bilateral, as you can see Figure 2 compared to Figure 1. The patient noted that the rash was less thick than before, which allowed him to bend forward without any pain due to the stretching of the rash. This positive effect on rash reduction was a 55% drop in his psoriasis area severity score, PASI, which actually does not meet the criteria of success as a sole agent, which requires around 75% drop. However, as we can see, it showed that it can be helpful as an adjunct therapy. Table 2. Finally, there was an improvement in overall quality of life with the DLQI Dermatology Life Quality Index score, 26 to 16 as you see in Table 2, in performing daily activities with less pain. This clinical improvement that the patient had may be attributed to the gut biome improvement, which may have a role in balancing the immune system homeostasis. The importance of this study is that psoriasis is currently managed with numerous topical emollients and systemic immune modifying agents. Topical agents such as corticosteroids are inconvenient and time-consuming. Systemic agents such as methotrexate and aducanumab are associated with adverse effects such as hepatotoxicity and immunocompromise. A safe food supplement that may improve symptoms of psoriasis and psoriatic arthritis, as occurred in this case, appeals to be promising. and thus a need to perform a randomized controlled trial to study the efficacy and safety of this cobiotic. Thank you.